If someone comes in with chest pain and it looks like they're having a heart attack, we can have the cath lab team in there within minutes and have that blood vessel open within the hour.
That critical speed is the result of major coordination, just one of the strict requirements to be named an accredited chest pain center by the Society of Cardiovascular Patient Care.
Accreditation is a long process, and it took a number of months and a lot of people involved to really put this together, bringing all the different players together and really optimizing patient care.
It takes a lot of effort in terms of manpower. When somebody comes in complaining of chest pain, our time point is to get EKG within 10 minutes. That gets read by an ER physician and assessment where the patient has to be roomed or a code STEMI has to be called overhead. If a code STEMI is called overhead, a lot of staff members come in, like the supervising nurse, pharmacy, x-ray techs, even staff from the cath lab. And at the same time, the interventionalist cardiologist gets called in to take this patient to the cath lab.
As an accredited chest pain center, the medical team at Salinas Valley Memorial Healthcare System works seamlessly with emergency medical services to make sure chest pain patients get the time-sensitive care they need even before reaching the hospital.
When a call comes in, the paramedics will end up placing EKG leads, and if the EKG shows what they call a code STEMI, that gets transmitted to the ER. And if it looks like that's what that is, that EKG gets transferred or transmitted to the intervention cardiologist. So everything's set in place. Now we have somebody coming with a code STEMI that gets activated before even the patient arrives here. As long as you can treat those people as soon as possible, the outcomes are tremendous. You end up seeing a lot of tissue of the heart.
The medical team at Salinas Valley Memorial Hospital's accredited chest pain center works just as quickly to determine which chest pains are not life-threatening.
From the nurses knowing exactly what steps need to be initiated if there's someone having an acute heart attack, to the steps of deciding who in the emergency department is not having a heart attack. So do you need to be here for 24 hours, 48 hours, and getting people who don't have a heart problem home where they belong and maybe addressing other potential causes.
The goal is to save those patients from unnecessary testing, costs, and the emotional stress of thinking they're suffering a heart attack.
And the faster we streamline the system, the better for the patient.